Powis, Medical Director of NHS England. I'd like first to update you on the facts about the spread of the coronavirus. Then I will outline why it is so critical that we continue to observe the rules on social distancing. Thirdly, I'll explain what we're doing to increase the capacity of the NHS to deal with this disease. And finally, I want to say something about how we can all work together to defeat this invisible enemy. First, the facts as they stand today. As of 9 a.m. today, a total of 183,190 people have been tested, of which 41,903 tested positive. 15,073 people in England have been admitted to hospital with COVID-19 symptoms. But the pattern of hospital admissions in England and Wales has regional differences. In London, the number of admissions fell slightly between the 1st and 2nd of April. Admissions are steady in Wales, but in Yorkshire and the North East, they've gone up by 35%. And in the Midlands, the rate of hospital admissions has gone up by 47%. 708 people have sadly lost their lives as a result of COVID-19, the highest daily total yet recorded. And that means that of those hospitalised in the UK, the number who've passed away now totals 4,313. Those numbers emphasise again the importance of maintaining social distancing measures to halt the spread of the disease. More than ever, we must stick with it, as the Prime Minister said in his video message. Now, I know that life under lockdown can be challenging, and some will be tempted on this sunny weekend to venture out and about. But, as the Health Secretary underlined yesterday, if we relax our adherence to the rules, we increase the risk for others. That's why it's so important to stay at home, to protect the NHS, and to save lives. We need to think of those on the front line and the sacrifices that they're making for us. As the Chief Nursing Officer for England reminded us yesterday, Ruth May asked us to remember 2 NHS nurses who died after contracting COVID-19. Arima Nasreen, who was just 36, and Amy O'Rourke, aged 39, each had 3 young children. They died while doing everything they could to help the sick and the suffering. We can all best honour them by playing our part in fighting the disease, by staying at home and slowing the spread. 7 healthcare professionals have now lost their lives to COVID-19, and we offer our heartfelt condolences to their grieving families and to the many others mourning the loss of loved ones. They include the family of Ismail Mohammed Abdul Wahab, who died aged just 13 in King's College Hospital in London. His mother and siblings are showing symptoms of the virus, and they were unable to say their final goodbyes at his funeral. In their despair, the loving, dignified tributes from Ismail's parents are truly haunting. Our thoughts today are also with the family of the 5-year-old child with underlying health conditions who's tragically died. So again, you must stay at home to protect the NHS and to save lives. Whatever the temptations this weekend, please don't go outside to visit the lakes, the beaches, the countryside. Take pride instead in keeping your own families and communities safe. The more we restrict contact, the more we slow the spread of the infection, the more time we have to build capacity in the NHS so that we can treat those who are most in need. And I want now to outline how we're increasing NHS capacity. Yesterday we were grateful to His Royal Highness the Prince of Wales, himself recently recovered from coronavirus, for opening the brand new Nightingale Hospital in East London, a testament to brilliant teamwork and determined leadership from the NHS. 2 weeks of hard work have transformed a convention hall into a fully functioning field hospital that can treat 500 COVID-19 patients on ventilators or through oxygenation. New Nightingale hospitals are due to be built in Birmingham, Bristol, Cardiff, Belfast, Glasgow, Harrogate and Manchester. And given that we know that the Midlands are a particular area of concern, the NHS and the military are accelerating their existing work to transform the National Exhibition Centre in Birmingham into a 2,000-bed Nightingale hospital. I've spoken to the Mayor of the West Midlands, Andy Street, earlier today, and he is doing all he can with the NHS to accelerate that work. Of course, a critical part of ensuring the NHS is resilient is improving the testing of staff. 10,984 tests were administered yesterday, and as the Health Secretary outlined on Thursday, we have a strategy to increase that number to 100,000 a day. Testing is a critical part of the clinical pathway that we all follow in seeking to reduce the impact of COVID-19. But the next vital step is appropriate pharmaceutical treatment. That is why, as the Health Secretary explained, clinical trials are now taking place to see if antivirals, which have helped in the fight against HIV, and anti-malarial medicines such as hydroxychloroquine can reliably reduce the harm that the coronavirus inflicts. The next stage in the clinical pathway is ensuring that those patients with impaired lung functions get the oxygen they need, and this is where ventilation comes in. We've been working to increase ventilator capacity across the NHS. Ventilation can be non-invasive and invasive. Effective non-invasive ventilation can ensure patients do not need to be placed on invasive ventilators, where they're intubated and supported to breathe with machinery which takes oxygen direct into their lungs. We've secured new non-invasive capacity with the help of UK manufacturers who've worked at pace to develop new technologies. A team from University College London, working with Mercedes-Benz, have produced a new device which has been clinically approved. They produced 250 yesterday, will produce the same number today and tomorrow, rising to 1,000 a day next week. We're also increasing the capacity of the NHS to deploy invasive ventilation. We've been buying invasive ventilators from partners abroad, including Germany and Switzerland, and today 300 new ventilators arrived from China. I'd like to thank the Chinese government for their support in securing that capacity. And we've developed new sources of supply here in the UK, with existing and modified models being made in greater numbers, and new models designed to come on stream soon. The first models, which have been scaled up as part of the ventilator challenge, will be coming off production lines this weekend. More are to come into operation in the coming weeks, subject to safety and regulatory approvals, as part of the Prime Minister's call to manufacturers to scale up production. Increasing this production has involved securing supplies of critical components, from lithium-ion batteries to flow regulators, from across the globe to assemble here. The first of the ventilators that the government has ordered from Penlon, a medical devices company based in Oxfordshire, will begin arriving in hospitals this week for final clinical checks. We're grateful to the MOD personnel who will be delivering them, as we are to all the companies who've devoted time, staff and resources to fighting COVID-19. The first devices from Smiths Group have also been received at MOD Donington, a military logistics hub in Shropshire. These have been approved by the regulator. The initial dispatch is the result of scaled-up manufacturing of an existing mechanical ventilator design, and we're grateful for the efforts of an industry consortium, including GKN Aerospace and Rolls-Royce. These ventilators will be distributed to hospitals this week. And next week, UK production of another ventilator device from the companies Diamedica and Plexus will start at their factory in Kelso in Scotland. The design is based on an existing product already in use in the NHS. The more ventilators, invasive and non-invasive, available to the NHS, the more patients can get the care they need when they need it. But the process of design, testing, assembly and manufacture does take time. We need to make sure that these devices are safe and their manufacture scalable. The challenges in increasing numbers are formidable, which is why the commitment of the scientists, engineers, designers and civil servants involved in this work is so impressive. But you don't need to be a scientist or engineer to help them. All you need to do is to observe the social distancing guidelines that have been put in place. The more we all stay at home and slow the spread of the disease, the more time we buy for more ventilators to come on stream and for the NHS to become more resilient. Finally, I want to turn to the way in which all parts of our country are coming together to fight this invisible enemy. Teachers have kept schools open for those who need them, and parents have kept their children at home wherever possible. So we enter the Easter holiday weeks with school attendance having been around just 2%, ensuring that the most vulnerable can be cared for. For children eligible for free school meals, vouchers will be available over the holidays to support household incomes. But I'm conscious that more must be done, particularly over the holiday period, to support children at risk and in need, and we'll be seeing more next week about work in this area. I also recognise that we're asking a lot of the British people. And we in government therefore have a responsibility to communicate as clearly as possible. Clear, factual, timely information and an honest assessment of the difficulties that we all face, as well as proper recognition of the achievements of those on the front line who are doing so much to fight this disease. Adapting to this pandemic has meant developing guidance, implementing new policies and coordinating efforts across government at an unprecedented pace. Inevitably, there has therefore been criticism of some government actions. I recognise that that criticism has been designed to challenge government's performance and to improve our response, which is why I welcome it. Even as we unite in our efforts to defeat the virus, we must also recognise that robust scrutiny is to be welcome. It's the duty of the media, which is why we're acting to both share robust information and support our media by investing more in our government information campaign, which is being disseminated through the national media and local newspapers and radio. We'll share essential health advice and information on the support packages which are available from the Chancellor for workers and businesses. We'll share details of how you can help to volunteer to support our NHS or help the vulnerable, and also how you can help our great British farmers by buying more locally grown products. We'll also list other ways in which you can join the national effort against the coronavirus. We're also using social media, in particular to reach young people, some of whom have been more reluctant than others to follow social distancing rules. And in this united national effort, where we need both constructive challenge and a shared spirit of national endeavour, we want to make sure that we all work collaboratively to help defeat the virus. That's why we've been coordinating daily with our colleagues in the devolved administrations, why I spoke yesterday to my friends in the trade union movement, Francis O'Grady and Len McCluskey, and why the Prime Minister has written today to the leaders of all opposition parties, including the new leader of the Labour Party, Sir Keir Starmer. I'd like to congratulate Sir Keir on his victory and wish him well in his important role. And I'd also like to emphasise once more that all of us can do our bit this weekend in that united national effort by staying at home, protecting the NHS and saving lives. And now I'll hand over to Steve.
Thank you very much. Well, as you all now know, the key to getting on top, to beating this virus, is to reduce contact with each other, to stay at home and to stop the spread of the virus. And as the first chart this afternoon shows, that we are continuing to see people adhering to those instructions. Transport use, in particular public transport use, remains extremely low. And it's absolutely critical, as you've just heard, that everybody follows those instructions. So the sun might be out, but that doesn't mean you should be out. We all need to make sure that we resist the temptation, whatever the weather, to disregard the instructions that are so clear. We need to stop social contact, reduce social contact, stop transmission and reduce spread of the virus. And by doing that, we will start to protect the NHS and to save lives. And as the next chart shows, the new cases in the UK have continued to rise, but in the last few days, they have stabilised. Now, it's really important, as I've said before, not to read too much into a day or a few days' data. But if we do reduce social contact, we know from the scientific evidence, we know from the experience of other countries, that we will see a reduction in infection rates. A reduction in infection rates, as the next chart shows, means a reduction in hospitalisation rates. For the vast majority of people, this is a mild, moderate illness, a bit like a cold or flu. But for a small number of people, it does mean that the symptoms are severe enough to require hospitalisation. It will be a week or two before the measures that are put in place translate into lower hospitalisation rates. But as you can see, in London in the last few days, there has been a bit of a plateauing in terms of numbers. Now, in other parts of the country, as you've just heard, hospitalisations are still going up. So this is not the time to be complacent and to take our foot off the pedal. We need to continue to comply with those instructions, because that will translate in the next week or two into a reduction in hospital admissions. And of course, finally, as the next chart shows, Unfortunately, and with great sadness, the number of deaths continues to be high. And as I and others have said, unfortunately, that is likely to continue over the next week or two until we get on top and stop this virus. And by doing that, we will see a reduction in the number of deaths.
Thank you very much, Steve. I will now turn to our colleagues in the media for some questions. And first of all, Ria Chatterjee from ITV. Ria.
Hi, this is a question for you, Michael Gove. Professor Neil Ferguson, a leading scientist advising the government, has warned that the COVID-19 infection rate in the UK could remain high for weeks and weeks. The weather is nice this weekend. People will be tempted to go out. People will go out. What is the government planning to do to make sure people stay at home? Because some people watching this broadcast will be asking if words are enough.
Well, thank you very much, Ria, for your question. I hope that I and certainly Steve have been clear. When we look at the death rate, when we look at the number of increasing fatalities, when we consider the pressure on our NHS, everyone has to ask themselves the question, what am I doing in order to relieve pressure on the NHS? How am I helping in this shared national effort? All of us have loved ones, all of us have relatives who are at risk as a result of the spread of this disease. If we want them to be safe, then we want the NHS to be as resilient as possible, and that means observing these guidelines. And I know that lockdown is challenging. I know it's very difficult, particularly, for families with children. It's a challenge. But people must, at every stage, respect these guidelines, because that's the only way of making sure that we restrict the spread of the disease. And of course, there are provisions in place, legal provisions in place, if people deliberately flout these guidelines. The police have instructions to engage, to explain, to encourage, and if necessary, to enforce the rules. But it's vital that all of us recognise that if we weigh up an hour or two outside and weigh it against the lives of those we love and the lives of those on the NHS front line, then it should be clear, I hope to all, that we should follow the advice. Steve, is there anything you want to say?
So my colleagues, my friends working in the NHS in the front line would absolutely plead to every member of the public to follow the instructions that they have been provided with. Their safety, their lives depend upon that. And of course, beyond the NHS, it's the lives and the health of all of us, our friends, our relatives, your friends, your relatives, that depend upon us following these instructions. And we know it can work. We absolutely know that this can work. And so, as I've said many times before, this is everybody's chance to save a life, to ensure that a ventilator that might have been used isn't used. And we need to stick with this. It's tough, it's hard for everybody, I realise that. But this is the time that we need to make sure that we don't, we stick to that guidance and we don't deviate from it.
Okay. Is there anything more that you wanted to follow up on, Ria?
That's fine, thank you.
Thank you. Next we go to Palab Ghosh from the BBC. Palab.
Mr. Gove, do you have any indication so far as to whether people are following the government instruction to stay indoors so far this Saturday? And I'd also like to ask Stephen Powis whether we should take any heart whatsoever from the flattening of hospital admissions in some parts of the country, notably London and the Midlands, and also to elaborate on comments made by Neil Ferguson again, that if we do follow the current restrictions, then perhaps by the end of May, some of the severe restrictions could be substituted by less intensive ones based on testing and technology. What did he mean by that?
Thank you very much, Palab. My impression is that people are adhering to the social distancing guidelines, but I also recognise that the temptation is there. As Steve said, when the sun is out, there's a temptation to be out oneself. But the indications that we have so far are that people are observing them, and they're doing so because the overwhelming majority of people are public-spirited and they want to play their part. Steve.
So every country in the world will have to work out its strategy for managing this new virus. And as I always say, remember, this is a virus that until a few months ago we didn't know existed and wasn't in the human population. And we are learning about this virus all the time. And the scientific evidence of how the virus is transmitted, how it affects immunity, will become more and more clear over the next few months. So yes, we will have to develop a strategy for coping with this virus, as will all countries. But it's a bit too early yet to say exactly what that strategy will be. The imperative at the moment is to get on top of it and to reduce transmission. So I'm absolutely sure that the advice, the scientific evidence will help those Chief Scientific Advisor, the Scientific Advisory Group for Emergencies, to formulate the best possible advice to the government going forward. But on this day, at this moment in time, the critical objective is to stop the spread of the virus by reducing our contact with each other and maintaining social distance. And it's only if we do that, and only if we are successful in doing that, that we can actually have the conversations about what the next steps are.
Is there anything more that you'd like to ask me, Pala?
I'd just like to follow up with Stephen, but on whether we should take any heart from the flattening off of hospital admissions. I know it's early days, but can we read that some of the early measures?
Yeah, so apologies for not addressing that direct. So as I described when we showed you the charts, and as I've said before, a reduction in transmission, so spread in the community, and there is some evidence that the measures that have been put in place, everybody's compliance with them, is reducing transmission, will over a number of days and weeks start to be reflected. The benefit will be reflected first in a reduction in infections, then in a reduction in hospitalisation, and then finally in a reduction in deaths. So yes, there is reason to be hopeful that some of the changes that we are observing in infections and perhaps in hospitalisations is now reflecting the benefit of the social distancing that everybody is complying with. But it will still take time for that to have its maximum effect. And this is not just about something we did 2 weeks ago or a week ago. This is something that we have to do now and in the days and weeks ahead. Because if we somehow decide that we need to take our foot off the pedal, if somehow we think that this is something for the days past and not the days ahead in the next week or two, then those charts will start to go in the wrong direction again. So the clear message, and it is a broken record, I'm afraid, from both of us, but the strategy at the moment, the imperative at the moment, is to maintain social distancing, stay at home, reduce contacts, stop the spread of the virus, and then we will progressively see the benefit of those actions.
Thank you, Pala. Thank you very much, Steve. We'll turn now to Tom Rayner from Sky.
Thank you. A question first for Mr. Powis. 13 residents of the Burlington Court care home in Glasgow have died in the last 7 days. They are suspected of having contracted COVID-19, but have not been tested because they weren't in hospital. How much higher do you think the death figures could be in the UK than what we are seeing in the official statistics? Because their deaths will not be in the numbers that we have set out today. And for Mr. Gove, if I may, nearly 1 million new claims have been made to Universal Credit just in the last few days. It is a system designed to encourage people into work, but it does that by incentivizing work rather than relying on the benefit. But when the vast majority of these new claimants are going to be unable to seek work, is it right that Universal Credit be made more generous?
Yeah. I'll hand over to Steve, first of all, to deal with your direct question about social care, and then I'll come back on Universal Credit.
So with great sadness and unfortunately, clearly deaths do happen in the community, and those are people who do not go to hospital and therefore do not pass away in hospital. So the figures that we report from the NHS are the figures for deaths in hospitals. The Office for National Statistics is able to report on deaths that occur in the community through the death registration process, and in the last week they have started to do that. So yes, I would expect that deaths will be higher than the number that are reported from hospitals, but I think it will only be in the days and weeks ahead, as that data starts to come through from ONS, that we will be able to answer the question that you've asked. This disease does not discriminate, or this virus does not discriminate. It affects everybody in all settings, unfortunately, of all ages. And therefore, as I've said, I do think, sadly, that we will continue to see the high number of deaths that we've seen at the moment. But as we start to get control of this through social distancing, in a few weeks, that will start to fall.
And on universal credit, Tom, you're absolutely right that universal credit is designed to support people in work and to help people to find work, and designed to incentivise work. But we're living, as you acknowledge, through unprecedented economic times, and universal credit is the means by which we're giving support to those who need it most. It's not the only means, however, that the government is deploying. As you'll be aware, there are up to 1.5 million people in the most vulnerable category, the shielded vulnerable, who we are distributing food and prescription medicines to. And it's also the case that a new task force led by George Eustice and by the Food and Farming Minister Victoria Prentice are working with local authorities and charities and others to identify other people who are vulnerable, who lack social networks, or who lack resources, in order to make sure that they can get the support that they need. But of course, we keep the whole welfare system under review in order to ensure that we can support people financially through a difficult time. Is there anything that you wanted to come back on?
Just on that point, Mr. Gove, your colleague, Matt Hancock, the Health Secretary, acknowledged that he couldn't live on £94 a week, the statutory sick pay. Universal credit has been made more generous by the government, but only by £20 a week, bringing it in line with statutory sick pay. Do you believe that that is acceptable when you have millions of people, many of whom will have been in full-time work, paying their taxes, that is now the level that the government can support them at? Or, given that these are exceptional times, would you consider making the system more generous?
I think we have to consider the nature of the system and whether or not we do need to ensure that we better support the vulnerable. We keep that constantly under review, and I think it's important that we do recognise that this is a very, very difficult economic time for very many. Yeah, I'll hand over to Ben Kentish from LBC now. Sorry, Ben. I know that you're asking the question, but the audio here in our press conference room isn't picking up what you're saying. I don't know if there's a technical problem. No.
Can you hear me now?
Yes, we can, Ben. Sorry.
All right, thank you. Mr. Gove, everybody watching this will be wondering the same thing. That is how and when this lockdown will end. You said before, understandably, it's too early to say when, but I wondered if you could help us with the how. Professor Powis just said there, it's almost too early to say what the exit strategy will be. But can you reassure people, because that will worry them, that the government does have a plan, an exit strategy, as it were, to lift this lockdown while also containing the virus? And just specifically, a couple of very quick questions to Professor Powis. Firstly, it's been said a lot that some of the experts advising the government believe that herd immunity, while not the strategy, is ultimately inevitable, that we simply won't be able to stop most people in this country getting coronavirus. All we can do is spread that out to ease the burden on the NHS. Can you level with people today and say that is the case, that most of us will get this at some point, or do you believe that not to be the case? And very specifically, there's been some early evidence from other countries that treating coronavirus patients with blood plasma with antibodies, or people who have recovered from the illness, can have a significant benefit. Is that something the NHS is looking at, and will you be asking people who've recovered to donate blood? Thank you.
Thanks, Ben. On your specific point about when the current restrictions will end, it depends on compliance. One of the points that Neil Ferguson was making earlier today, one of the points that Steve and I have been seeking to make today as well, is that the more effectively people comply with what we acknowledge are very stringent conditions, the more that we can slow the spread of the disease, the more resilient the NHS can be, the more that we can move to a different phase in due course. But it does rely on people observing that. So there's no fixed point, no specific date in the calendar at which we can say that things will change. We're keeping them under review. The Prime Minister said that the current lockdown proposals will be reviewed in what is just over a week's time. But we need people to comply now. The other thing that I would say is that, as Steve, I'm sure, will say more about, we're dealing with a wholly new virus. We're dealing with a new virus whose spread and whose capacity to cause death are unlike those that we've seen specifically before, and therefore we need to be certain that in every area where we can fight this virus, we are improving our capacity and making sure that we have the flexibility needed as we move to a different phase to have all the tools ready in order to fight it. And those tools will include, of course, not just some of the treatments which are undergoing clinical trial at the moment, but also some of the vaccines that we're seeking to collaborate with other countries to develop worldwide, and also making sure that the NHS itself has the resilience required to deal with more cases in the future. Steve.
Yeah, so I don't particularly like the term exit strategy. I think we should think much more of how we are going to manage this virus over the next months, because it is very likely that this virus will become established in populations throughout the world. And so we need a strategy to manage this over time, not just in the next few weeks or the next few months. And as I said earlier, all countries will be thinking and working together on what that strategy must be. Secondly, as Michael has said, and I've said, scientific knowledge about this virus is still being discovered. We're still in the early stages. And as we learn more about it, as the scientific evidence builds, then that will allow those strategies to evolve. So immunity is one part of a viral infection and an epidemic, but it's not the only part of it. As you've just heard, successful drug approaches, and we are recruiting people into clinical trials, the use of vaccines are all important parts of strategies to manage any infection. And as we learn more about effective drug treatments, as we see vaccines coming up in the future, they are all important components of how in totality you manage an infection. And if we look back at past infections, so if you go back 40 years ago to HIV and AIDS, a different sort of infection coming into the population, but over time strategies were developed to manage that infection. So we can manage infections through various strategies, of which immunity is one part. And I should say, as I've said before, one of the important things when it comes to immunity that we still need to learn, because it is too early in this epidemic and pandemic to learn this, is what sort of immunity is generated in people, how long that immunity lasts. And that will all be important information as we develop strategies in the months to come.
Thank you very much, Steve. Anything more you wanted to ask me, Ben?
Could I just come back on that specific point? You talk about the managing the illness. The question was about whether you therefore expect most people to get it. I'd be grateful if you could just say a little more, if we're managing it rather than stopping it, is it the case that at some point most people in the UK will get this virus?
So not necessarily, because it depends upon all those things that I've talked about. So it depends upon effective drug treatments. It depends upon effective vaccine strategies. So it's not trying to avoid the question at all. It's simply to say that we are too early on in a virus that 3 months ago we knew nothing about, didn't know was in the human population, to answer those questions. So I don't want anybody to get the impression this is the avoidance of questions. This is the reality of learning about a new virus and a new disease.
Thank you very much, Steve. We'll turn now to David Wooding, from The Sun on Sunday. David.
Good afternoon. We've had some reporters down at the O2 and Chessington following the excellent good news announcement by your colleague, the Health Secretary, this week, that 100,000 tests per day will be carried out later in the year. And we found lots of problems with bureaucracy, people turning up and leaving untested, NHS nurses are in tears because they're told they need an email or they need identity or an appointment. What can you do to cut through this red tape? Because there's no point in bringing in extra tests if people can't be tested in the system that's in place. And if I may throw in a quick one too, we've heard today of 5G masts being burned down by people who have read false rumours on social media that these masts are in some way responsible for spreading the virus. Can you please debunk that myth for us, please, and explain what damage these people are doing to communication at a very difficult time for this country?
Thank you very much, David. On the first point, I'm very grateful to Boots and to others who've played a role in making sure that we can have drive-through testing in Chessington, in the O2 Centre and in other sites. It is there specifically for NHS workers, and the aim was to make sure that only NHS workers had access to it. But if it's, as your reporters have discovered, being enforced in a bureaucratic fashion, then I will talk to Matt immediately after this press conference, and we'll make sure, working with the Boots team and others, that those who need those tests get those tests. And thank you for that reporting, because it's precisely that sort of investigative work that makes sure that we can, when we encounter problems and bureaucracy, try to cut through the red tape. So we will do that, and we will report back tomorrow or at Monday's press conference any progress that we've made. On the point about the 5G masts, thank you again for mentioning it. The story somehow got about that they play a role in the spread of the disease. That's just nonsense, dangerous nonsense as well. And I'm hand over to Steve to say a little bit more about the vital importance of knocking down this rubbish. Yes.
So the 5G story is complete and utter rubbish. It's nonsense. It's the worst kind of fake news. The reality is that the mobile phone networks are absolutely critical to all of us, particularly in a time when we are asking people to stay at home and to not see relatives and friends. But in particular, those are also the phone networks that are used by our emergency services and our health workers. And I'm absolutely outraged, absolutely disgusted that people would be taking action against the very infrastructure that we need to respond to this health emergency. It is absolute and utter rubbish, and I can't condemn it in stronger terms than that. On the testing, the good news is we said that we would ramp up staff testing. We're actually testing staff not just through those drive-through places that you have seen, or those drive-through facilities, but also in spare capacity in our NHS laboratories as well. And I'm pleased to say that yesterday we tested over 2,000 NHS staff in the capacity we had in our NHS laboratories. That's 16% rise on the day before, 34% on the day before that. And the latest data shows over 4,000 staff have been tested in those drive-through facilities. So we are increasing staff testing all the time, which is really important, so that where staff or their household members don't have coronavirus, they can come back to work and assist with the pressure that is clearly building on the NHS at the moment.
Thank you, Steve. Anything more that you wanted to ask, David?
No, that's fine. You've covered my points well. Thank you.
Thank you very much, David. Thank you. And we'll turn to David Maddox of the Sunday Express now.
Good afternoon. To begin with, could you give us any indication as to why the numbers of infection rates appear to have jumped up so quickly in the Midlands and the North East and Yorkshire? Also, a question for Michael Gove. On the help for people, the self-employed in particular, is there any possibility that this could be reviewed, given that people who have company directorships, who often don't get much money from those company directorships, are now blocked from having any of that help? And finally, in terms of exit strategy, and sorry to use that term, Professor Powis, but do you have an infection rate in mind as to when the lockdown measures, social distancing measures, may be scaled back?
Thank you, David. I'll take the second question and hand the first and the third over to Steve. The package that we've put in place in order to support the self-employed and also to support workers and the economy overall has been designed in order to help those principally on lower incomes, in order to help them through a difficult time. It's been designed specifically targeted in order to do that. But as we've seen in the course of this week, the Treasury are keeping these schemes under review and are doing everything they can, working with the banks and others, in order to help support viable businesses, to keep people in employment and to put the government's hands round every working person. So if there are specific examples of inefficiencies in the way in which the business support scheme or support for the self-employed is operating, then I know that the Treasury will want to look at them in order to make sure that support is targeted as effectively as possible. But I'll hand over to Steve on the question about the regional spread and also about how we manage our way out of the current situation.
So on the geographical variation, I think it's difficult to give a particular explanation as to why any particular part of the country has a higher rate at any one time. I would say that perhaps, not unsurprisingly, London as a major urban centre has an infection rate which is maybe a week or so ahead of the rest of the country. But for instance, if you look at a normal winter and look at the spread of flu in a normal winter, it's not unusual to see flu rates in the winter pop up in one area of the country before they rise in another area. So that geographical variation is actually to be expected, although, as I say, it's difficult to get under the skin of why one particular area versus another might have a higher rate at any particular time. So not unexpected. On the infection rate per se, no, I don't have a particular figure for infection rate, and I think it allows me to highlight one of the bits of scientific information, one of the pieces of the jigsaw that I've been talking about earlier, that we don't know about yet, but which will help us when we develop strategies going forward. So we are still not clear how many people might have had this virus but have not developed symptoms. That is work that's going on internationally, and in fact it's work that's going on in this country as I speak to try and understand what that figure is. When that information becomes available, when that scientific knowledge is known with large numbers of people, that will help us not only in our strategy going forward, but in our understanding of infection rates per se.
Thanks very much. Is there anything you just wanted clarity on there, David?
Just very quickly then, are you putting more weight on infection rates or hospital admissions in terms of your strategy going forward?
Well, I think the strategy has been quite clear, and it continues to be the strategy. The strategy is to save lives and to protect the NHS. Save lives because clearly we wish to save lives. As a doctor, that's why I went into medicine. Of course, we need to save lives. But putting less pressure on the NHS is important for a number of reasons. Firstly, as I've said before, our strategy is to build capacity in the NHS. So at the same time as we are reducing the spread of the virus by the measures that the government have put in place and that we all must follow, so reducing demand, we have worked hard to make sure that we're ahead of the curve and we have increased capacity. And you've heard about the Nightingale Hospital and more Nightingale hospitals today. So we still have capacity within the NHS, even in London, we are ahead of this surge. And I think that's down to the huge efforts that the NHS has put in. So going forward, the strategy will need to be to continue to make sure that the NHS can cope with this and that we save lives. So those are the two pillars of the strategy going forward.
Thank you. And we'll turn now to Michael Savage from The Observer. Michael.
Thank you. First to the Secretary of State. On compliance, you mentioned in your introduction about young people using social media to reach them. Do you have demographic data suggesting they're being less compliant at the moment compared to other demographic groups? And also, we're 2 weeks into this now. You're having to work very, very hard to implore the public to stay home. What other methods could the government call upon when we're months into this rather than weeks to ensure compliance continues? And to Professor Powis, if I could, question on ventilation. Neil Ferguson says we might reach a peak in 7 to 10 days. According to our models, how many ventilators will we need at that point? And how many do we think we will have? Thank you.
Okay. Thank you very much, Michael. The evidence does suggest that compliance does vary across different sections of the population, and there has been evidence to suggest that for some young people there's been a lower level of compliance, and that's why it's important that we reach them appropriately. It may be that some of the messages and some of the channels that we've used have not reached some sections of the population. It may be that younger people feel that they're less likely to be affected and less likely to be infected. One of the reasons, therefore, for trying to make sure that our message is consistent is that for some, you may hear this message again and again and again and think, well, the government is, as Steve mentioned earlier, sounding like a cracked record. But there'll be many who won't have access or don't access traditional media, and we need to make sure that we get the message through to them. The evidence is that people appreciate why it's important. People appreciate the ethical reasons why self-restraint can help others at a time like this. And it's because people are building up that broad social understanding that I'm confident that we can work with the British people to ensure that over the weeks, for as long as it takes, that we exercise the self-discipline required in order to beat this virus. But you are right in the implication of your question. It is tough, and I particularly appreciate that it is tough for families, it is tough for those in economically vulnerable positions, and that's why the government is always looking at ways in which we can help those by making sure that we're alive to the pressures that they face. I'll hand over to Steve on ventilator capacity, but one of the things I would say, as I emphasised here, is that the more that people observe these social distancing guidelines, the more time we buy the NHS, and the more ventilator capacity, non-invasive and invasive, we can secure, and that has to be our aim.
Yes, so that's exactly right. And as I said in answer to the previous question, the NHS strategy has been to constantly build capacity so that we stay ahead of the demand. As Michael has said, we need to reduce the demand. We're doing that through social distancing and staying at home, but we have planned over the last few months to stay ahead of capacity. So I won't give you a number in terms of our aim for ventilators, but I will say that we are constantly looking to procure ventilators, and the call to arms for British industry is also aiding in getting ventilators from sources that we didn't have before. And Michael has mentioned non-invasive ventilation, so that is ways of ventilating to providing oxygen support to people where you don't have to put a tube down into the lungs and down into the windpipe to do that. That's invasive or mechanical ventilation. And we are learning all the time, not least through international collaboration, as to how non-invasive ventilation might be used. So the overall strategy is to keep our ventilation capacity and our critical care facilities ahead of the demand, and we have successfully done that so far. And if we all comply with the measures that are put in place, that have been put in place, then that gives us a very best chance that the demand never exceeds the capacity. And one final thing I'd say about capacity. So I think it's important that everybody realises that although we are focusing on increasing capacity to deal with the coronavirus, the NHS is still working, as it always does, for people with other health emergencies. So it's really important that at this time when there's a focus on COVID-19, that if you have symptoms of a stroke, that if you have symptoms of a heart attack or any other emergency, that you are contacting the NHS and the health services as normal. Because the NHS is focusing as hard on people with other conditions, other emergency conditions, as it is on coronavirus. And it's important that we do both of those at the same time, and that has been our strategy and will continue to be our strategy.
Thank you very much, Steve. Anything you wanted to follow up on with me, Michael, or...?
Could I just ask quickly whether your introductory remarks about ventilation change the underlying numbers? That is broadly that we have just over 8,000 ventilators and 8,000 on order.
I think it's important to stress that we have more than 8,000 ventilators in the NHS now, and we want to increase capacity well above the 8,000 additional that has been cited. And we want to be in a position where we have the highest level of ventilation capacity possible, which is why we are, as I mentioned earlier, not only producing non-invasive ventilators with the help of UCL and Mercedes-Benz, but also why Penlon Smiths Diamedica and other companies are also working with us. It's also why we're sourcing ventilation capacity from Germany, from Switzerland, from China and elsewhere. With that, I just want to say thank you to Steve and to all the staff in the NHS, and to say thank you to our colleagues in the media. And there'll be another press briefing, of course, tomorrow. Thank you.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.